All right. So when we talk about the body, we always have to discuss it in the same way so that a doctor, no matter where you are in the world, knows what you're talking about exactly. So we always discuss the body based on anatomical position, which means, and keep in mind this model is not exactly an anatomical position. Anatomical position is your eyes are forward, your toes are forward, your arms are at your side relaxed with your palms facing forward, and you're standing erect. So we consider that anatomical position. So no matter what, even if you're a patient, you're a victim, whoever you're coming upon to treat clinically, whatever position they're in, you have to imagine and describe them based on anatomical position. So, based on anatomical position, there are several orientation direction terms that are important that you get down really early on because we use them in anatomy and beyond in a clinical type profession. So, the side of the body with the eyes on it is considered the anterior side, so the front. The opposite of anterior is posterior. So if we flip Sassy Gal over, this is looking at her posterior view. So we'll flip her back over, put her chest plate back on there. Okay. So anterior versus posterior. Some textbooks use a little bit different terminology. So anterior and ventral are going to mean the same thing, and posterior or dorsal are going to mean the same thing. Another thing that you may hear in anatomy is cranial, which means something is more towards the head. Caudal really is something we don't use a whole lot. Caudal refers to tail. So in a human, it would be the base of the spine. So if something's cranial, it's towards the head. Caudal would mean towards the buttock area or base of the spine. A term we use all the time is superior and inferior. Superior means above, inferior means below. So based on this model and anatomical position, the nose is superior to the chin. The fingers are inferior to the elbow. Medial and lateral, anything that's medial is going to be towards the midline of the body. Lateral means to the side. So in anatomical position, I'm going to hold my hand out. In anatomical position, my pinky finger is medial to my thumb. My thumb is lateral to my pinky finger. And remember, always an anatomical position with your palms forward. That will always be true. Superficial and deep. Superficial refers to being on the outside of the body. So here, the muscle is superficial to the organs inside. The organs are deep to the muscles. Proximal and distal is a term that can have overlapping meaning to superior, inferior, sometimes medial, lateral, sometimes cradiocaudal. Proximal means closer into the core of the body. Distal means at a distance. So as an example here, my elbow is more proximal to my shoulder than my fingertips are. My fingertips are more distal to my shoulder than my elbow is. Distal means at a distance. Proximal means closer into the body. And another bit of terminology that we don't use a ton, but you may see in a typical gross anatomy cadaver type lab, if you're in anatomical position, you're a cadaver, you can't stand up. So anatomical position, but you're laying on your back and your eyes are facing the ceiling, toes are facing the ceiling, palms are facing the ceiling. We call that supine. So the supine position, you are laying on your spine. Prone is the opposite of that. So prone means you are laying on your belly. in anatomical position with eyes facing the floor, toes facing the floor, etc. So prone, you're prone to being kicked.